So hearing loss in the middle ear. Abnormalities of the middle ear produce conductive hearing loss, and the more attenuation produced by the disorder, the worse the hearing. So otitis media, that is an ear infection of the middle ear space. It's one of the most common disorders of the middle ear, produces a conductive hearing loss, an infection of the middle ear space that affects nearly 70% of children before the age of 2. It's caused by poorly functioning eustachian tubes, abnormalities of the cilia in the middle ear space, or anatomic deformities of the middle ear. There are additional factors that influence its prevalence: age, race, socioeconomic factors, weak immune system, and cigarette smoke. Here's a picture of the eustachian tube in infants compared to the eustachian tube in adults. So you see in infants, it's much more horizontal. So when they get a cold in their nose, they're much more likely to blow that cold into the middle ear space, whereas for adults, with it being on a more vertical plane, it's more difficult to blow a cold in their nose up to their middle ear space. Otitis media is primarily a disease of childhood, but it can occur at any age. It's more common in the winter when there are more colds. It's more prevalent in women than men. It's more common in Eskimos and Native Americans. This might come up on the praxis because of their facial structure, and it's a major cause in children is tobacco smoke. You might have seen those public service announcements about smoking, and there's a baby sitting on the floor of a person's apartment crying in pain with a middle ear infection, while there's background secondhand smoke. Otitis media is an infection that usually begins in the eustachian tube and travels up from the nasopharynx. It spreads throughout the middle ear cavity. The infection can be blown in through the eustachian tube by a stifled sneeze or blowing your nose too hard. When the eustachian tube is infected, it becomes swollen. This interferes with the middle ear pressure equalization function, and the cleaning action of the hair cells is compromised. Here's a picture of the fluid in the middle ear space. So the middle ear space is supposed to be filled with air, not fluid. When it's infected, when there's an ear infection, it gets filled with fluid. Medical treatment is important. So eustachian tube swelling, occlusion of the tube can produce a negative middle ear pressure, type C tympanograms. The tympanograms of a middle ear that's infected might be red. I remember when I was a little kid, I had one, and for some reason I remember the doctor saying that my ear was as red as those medical waste bins. They're painful. They're painful, and the blood supply in your tympanic membrane is, infected. It's supposed to be clear, and it's swollen, and it just hurts. Suppurative otitis media is when the mucus becomes filled with excessive amounts of blood and pus accumulates. You have ear pain, body temperature. The child might be visibly ill, or the adult. If left untreated, the tympanic membrane may rupture. That pus can find its way out or invade the mastoid bone, causing mastoiditis, which would be a breakdown of the wall separating the air cells in the mastoid bones. And remember, I said before, you want no infections near your brain, so unfortunately that could spread and lead to possible death. You might remember a few years ago when Ebola was in Africa and everyone was terrified of Ebola, the Ebola outbreak, but tens of thousands more children die every year in Africa of ear infections, untreated ear infections, than the Ebola virus. Otitis media can be chronic or acute. Chronic means long-standing. Acute, the symptoms develop rapidly. A conductive hearing loss can be seen on the audiogram, and the amount of hearing loss is related to the accumulation of fluid. Bone conduction tests are usually normal. Flat type B or negative type C tympanograms are usually noted. Antibiotics should be used appropriately to treat the ear infection. There's also surgery for more severe cases to help remove the fluid from the middle ear space. An incision is put in the tympanic membrane. A mastoidectomy, my grandfather, I think, in the turn of the century, the 1900s, the 19-teens, he had his mastoid bone scraped because there was an infection in the mastoid bone from his middle ear infection, and they didn't have the antibiotics to treat it. Tympanoplasty is the surgical reconstruction of the middle ear space to put the middle ear structures back together, but this could lead to a loss of function in one or more ossicles, and the hearing improvement varies. Another condition could be negative middle ear pressure. That's when you feel really stuffed up. You know, when you have a bad cold and you feel stuffed up, the tympanic membrane is retracted due to eustachian tube dysfunction, and this interferes with the normal vibrations of the tympanic membrane and may produce a slight conductive hearing loss. When the eustachian tube is chronically open, it says head in the barrel feeling, where a voice might be perceived as louder than normal. This could occur in women when they're pregnant and they have hormonal changes. There's nothing you can really do about it. Serous effusion of the middle ear. So having a lot of untreated fluid in your middle ear can cause a real problem. You would get a type B flat tympanogram, and as the level of fluid rises in the middle ear, it would result secondary to poorly functioning eustachian tube. A decongestant might help restore the normal fluid, but the fluid might be there and continue to build, and to help drain the fluid, an incision could be put in the tympanic membrane. You could use PE tubes. Some of you might have had them, pressure equalizing tubes, to directly vent the middle ear space through the tympanic membrane in the ear canal. So PE tubes act as an artificial eustachian tube to help drain out the fluid of the middle ear space. And they stay in place for several weeks or months, and they fall out naturally. So here's a picture of these PE tubes.